A new regional effort has been launched to help address behavioral health issues locally.
Right now, we are joined by Erie County Commissioner of Mental Health, Sarah Bonk, and Jane Magavero, Executive Director of the Patrick P. Lee Foundation. Ladies, thank you so much for coming in this afternoon.
Thanks for having us.
Thank you.
So first, tell us about this special collaborative that was unveiled today and really why it was created.
Yeah, we are very excited to announce the Crisis to Care Collaborative. It's really the first of its kind that's bringing together both government, partnership from all levels, philanthropic endeavors, our NGOs, and our partners in community together to really ensure that we're establishing an accessible and interactive crisis stabilization system that leads people to the path of recovery.
Many people will say that we're in a behavioral health crisis, mental health crisis. How is this partnership really going to work?
So what I think is really amazing about this partnership, as Sarah said, is that we have stakeholders representing 50 organizations, from advocates to people with lived experience, the behavioral health providers, law enforcement, first responders. But really, it's an incredible commitment from a leadership team of the City of Buffalo, Mayor Scanlon, Deputy County Executive Lisa Chimera. Our commissioner here is serving on that leadership team, along with Commissioner of Central Police Services, Brian Ross. I know I'm forgetting.
We said the sheriff?
Sheriff Garcia. It's really just incredible to see this bipartisan effort, public-private partnership. Everyone's working and doing an incredible job with what they have, but we realize there has to be a collaborative across these systems. Tom Katorchi from ECMC is the other one. Yeah. So.
There's a focus on the mental health response, right? Maybe when someone is having a mental health emergency, what difference can a specialized response make in what they're dealing with?
Arguably all the difference. Having a mental health or behavioral health response to a behavioral health crisis is paramount, and we just don't see that happen enough. It's not just an Erie County issue, we see that happen nationally. So that's really where that work to take our stakeholders, that group of stakeholders and the community, listening to them directly to make sure that the answer is provided by us, not to us. And so that's really important to make sure that we have that community representation.
Yeah. Our data has found, we've brought in national experts to sort of help us look through this data of 12 different partner organizations. In the city of Buffalo alone, 10,000 mental health calls are coded each year. 68% receive a law enforcement police response. And that's not what people want or often need.
And is this partnership really going to be focused on maybe day-to-day calls, as you were suggesting? There are a lot of them, or programs in general to transition people to get them the services that they need?
Yeah, so
it's a good question.
Yeah, we're using a framework called Call, Respond, Go, and this is a national framework. So we're really breaking down the system into call, so someone to call, someone to reach out to, who's responding, and then where can those individuals go if they need a higher level of care. And so I think that's really the transformative part. Some communities are looking at just one piece of that, and we're really following an individual through the whole system.
You mentioned, the focus on partnership, right, between, so many local leaders, experts, amazing groups and organizations we have right here in Western New York. May is also Mental Health Awareness Month. If someone out there is watching this right now, maybe they want to focus a little bit more on their mental health. What should they do right now?
Ooh, now that is, so I appreciate that question, because now is the time with May being Mental Health Awareness Month. Part of that is making sure we just ask for help, right? But the responsibility is not so much on the individual who needs the help, but for the rest of us who may not be experiencing that need, to make sure we're setting that stage that it's acceptable to ask for help. So really just setting the stage of community. How do we start to check in on one another? How do we ask? And part of that means using our local resources, reaching out to the hotlines, crisis services, 988 as they're available, and making sure that that ask is made. But it's on us to also make sure we're ready to receive that ask. So that's a big part of it.
And also social media. Everyone's on social media these days, and we have seen the evidence out there that it can have a destructive impact on folks here. Do you think that there's enough conversation about social media and also the funding, the resources behind it? Do you think that there's more resources going into this issue to actually make it more of a priority?
So I think Governor Hochul has done an incredible job prioritizing mental health and certainly youth mental health services. I mean, Sarah is the clinician, so I can turn to her, but I would say from philanthropy's point of view, I see this conversation happening much more frequently than it used to. I've been in this role 9 years, and the number of partners that we see at the table now is much more expansive and encouraging that this younger generation is a little more willing to share what they're going through.
Before we let you go, if people out there want to learn more about the collaborative, where can they turn?
So crisistocare.org. This is a wonderful way to keep track of our progress. We really believe that we're going to be transparent, we're data-driven, we want the community to be involved, and so that's a wonderful way to sign up for updates and stay involved with us.
All right, very good. Very important discussion here. Thank you both for coming on in.
Thank you very
Thank you.
much.